Let's talk gut health and nutrition after bowel surgery. For those of you that don't know, I had excision surgery for my endometriosis, and that surgery involved a bowel resection. A resection is when the unhealthy part of a bowel is removed and the healthy parts are joined back together. Keep an eye out for my surgery video if you want to see how that played out. I've already shared about the immediate aftermath of bowel resection surgery in this post. Today, I want to talk about the nutrition side of things and how you heal your gut after such a big surgery. As I shared, I was put on a strict diet post-op, low fiber and low fat. I don't know what you're thinking, but fiber is good for you. We're always being told to eat more fiber. Well, that's not the case after bowel resection surgery. I was told to only eat foods that had 3 grams or less per 100 grams of fiber. This is because the bowel is going through a reset. It's slowly waking up and we don't want to overburden it. Fiber puts the bowel to work by providing bulk to help move waste through the body. Having too much fiber when your bowel is effectively restarting can result in constipation. And constipation is exactly what you want to avoid post-op. Both fat and fiber can be difficult to digest early on, and they can cause excessive gas. Something else you want to avoid. Trust me, you're in enough pain and discomfort. The last thing you want is food blocking your bowel or painful gas. On top of that, meals have to be little and often, so small in portion and eaten more frequently. I'm talking 5 to 6 meals a day as opposed to the traditional 3. Now let me tell you, I was so nauseous for the first 10 days. That's right. I said 10 days. It wouldn't have mattered what you put in front of me. I literally had no appetite. But because I wanted to get through this horrific episode as quickly as possible, I opted for the healthiest options and stuck to anti-inflammatory foods. Anti-inflammatory for me. That meant eggs and avocado for breakfast, and my mum's sourdough bread on occasion with a little seedless jam or honey. Lean meat at every other meal to get enough protein, which is particularly important for healing and recovery post-op. Together with broccoli and cauliflower florets, cooked carrot or asparagus tips with white basmati rice or potato. Then I'd have either banana, apple or peaches, the only fruit allowed, skinless, with kefir yogurt, organic cornflakes or oatmeal as dessert. And then I was lucky enough for my mum to make me homemade bone broth too. I started with the smallest portions, the teeniest spoonfuls, until I got my appetite back. And you have to remember to eat slowly and to chew your foods thoroughly. Foods to avoid include whole grains, fruit or veg with skin or seeds other than the ones I mentioned. Think from citrus, berries, kiwis, pineapple, raw veggies, nuts and seeds, veg with tough stalks like celery, mushrooms, onions, green beans, Brussels sprouts, all beans and pulses, lentils, baked beans, chickpeas. You're not allowed any of that. And hopefully, after 2 to 3 weeks of this strict diet, you've managed to have regular bowel movements and aren't suffering with things like constipation or urgency or anything that's unsettling. If you're all good, you can begin the reintroductory phase. Here's when you can introduce one food at a time from the high fiber or avoid list to see how you react. Does your bowel tolerate it okay? Or does this food give you painful bloating or constipation? Soon enough, you'll ease back into some kind of normal, which is very important. Remember, such diets are very restrictive. They're not meant to be done long term, as the gut needs a wide array of foods to maintain a healthy ecosystem or microbiome. Now, as hard as this surgery has been to recover from, I feel extremely fortunate and grateful to have experienced regular bowel movements pretty much from the get-go, and for my pelvic bowel pain to have subsided just a few weeks post-op. As I've shared, I was on hard pain meds, opioids, for the first 1 to 3 days post-op while recovering in hospital. After that, I was on 500 milligrams of paracetamol every 8 hours only for about a week. So after 10 days, after such a big surgery, I was completely pain medication free. And I owe it all to the way that I prepared my body pre-surgery and the protocols I followed post-op. Supplement-wise, I was careful. I had to tread carefully and only take what my bowel could tolerate. That included probiotics after completing my course of antibiotics, magnesium, vitamin C, and vitamin D3 and K2. I'm going to dedicate a separate post to my methods for pain and inflammation management because it's all truly worked so well for me that I hope it does the same for you too.